Good morning, Mr. Peter. It's a pleasure to have you here too. So we're just waiting to start the session proper by 11:10. This is to allow for more people to join. I can see that more people are joining the session, and then we'll start the session proper in 4 minutes. And good morning, Romo, Justina. Good morning, everyone. So we'll be starting the session proper by 11:10, and so for all those that may have a question or two, please get ready to post your question in the Q&A box so that our facilitator for today will be able to handle it. So just before we start the session, I'll be launching a poll. Please, we'd like to get your feedback on today's session, and your feedback is very important to us. Thank you. So a poll has been launched on the screen. Please do us well to please fill this poll. Your feedback is very important to us and we'll always let you know. We'd like to hear from you. We'd like to know what you think about this session. So please kindly fill the poll that's been launched on the screen. Thank you. Oh, Justina, please, are you saying that you cannot see the poll that's been launched on your screen? Please, can everyone confirm if you can see the poll? Okay, thank you so much, Kajdat. So for those that cannot see, okay, if you can't see the poll, I'll be posting the link in the chat box shortly. This should help you fill the poll. So I'll be posting the link in the chat box shortly. Please just bear with me a bit. So I'm still working on trying to get the link to us or get the QR code to us in the chat box so we can scan and fill the poll. But I can see that those that have seen the poll have started filling. So good morning once again, everyone. My name is Omotayo Akinwumi. I'm the business and project support officer here at the Lagos State Employment Trust Fund. Please, can we all confirm that you can hear me in the chat box, please? So please, I need to Okay. Good morning, everyone. Please, can you confirm that you can hear me loud and clear? Um, I think I had. Okay. Thank you very much. So, welcome to today's session. My name is Omotayo Akinwumi. I'm the Business and Project Support Officer here at the Lagos State Employment Trust Fund. And today, we have the privilege of having with us a very distinguished personnel from one of our partners at the Lagos State Health Management Agency. And he'll be taking us through today on the importance of our health, not only our health as business owners, but also the importance of having health insurance policy, including how we can get registered under the Lagos State Health Management Agency health scheme, which has been tagged Lera Eco. And today, I'm very sure would love to learn the importance of how we can, as business owners, our health is very important. And it is very important for us to ensure that everything that has to do with our health is being taken care of. And I have with me Mr. Dr. Olubenga Fadipe. Mr. Olubenga Fadipe is a physician with over 20 years of professional experience, including more than 15 years in the managed care industry, specializing in health financing and health economics. He currently serves as the head of medical operations at the Lagos State Health Management Agency, LASHMA, where he oversees access to quality healthcare services for enrollees under the Ilera Eco scheme. In his role, he also leads the development of processes that promotes efficient resource allocation and contributes to strengthening the overall health system in Lagos State. Please, can we all welcome Mr. Olubenga Fadipe as he takes on today's session? Mr. Olubenga, please, you can go ahead, sir.
So, hello, good morning. Can you all hear me?
Yes, we can hear you, sir. Loud and clear.
Okay, thank you very much for having me. I see today as a very important and strategic opportunity to be able to talk about social health insurance scheme that is called to everybody. Just as a form of introduction, Benga Fadipe is my name, and as the moderator has said, I currently work with the Lagos State Health Management Agency as the head of medical operations. So what that means is that when you're under LRFO and you have to access medical service in a hospital or any other health facility, departments that handle that space. And if you also have issues in terms of the healthcare you have received, and you want to complain to the department in such complaint. That is basically what it is. So again, our conversation here is about Ilera Eco. I mentioned at the beginning that Ilera Eco is the main business, the Lagos State social health insurance scheme. Now, how did it come about? In 2016, the then House of Assembly in Lagos State passed the Lagos State Health Scheme Law. That Lagos
Apologies,
State Health
Mr. Apologies, Mr. Olubenga. It seems there is an echo with the voice, so we can't really hear you clearly.
Okay, hold on.
All right, sir.
Okay, what about now? Is this still echoing?
A bit, yes, sir.
It's still echoing.
Okay, it's better now, sir. It's better now, sir.
Yes, sir. All right, thank you. So I was saying that in 2015, the then Lagos State House of Assembly passed the Lagos State Health Scheme Law. That law established three things. It established the Lagos State Health Scheme, it established the Lagos State Health Management Agency, which is LASHMA, and it established the Lagos State Health Fund. So the scheme is supposed to provide quality and affordable health care for all Lagos residents. That's one. That means if you live in Lagos and you work in Lagos, whether you are employed by someone, you are self-employed, or you are unemployed, you are expected to subscribe to Lagos State Health. Second one is the agency that is supposed to supervise and promote, and then the fund is supposed to aggregate funds together to ensure that services under the scheme will be paid for. So those are the three things that the law has. Now, as a form of explanation, the law said in 2015 that it is mandatory for every resident of Lagos State to have health insurance, which means you can have social health insurance, which is a miracle, or you can have a private health insurance that is sold by any of the private systems. But in 2026, the NHI Act now, that's the National Health Insurance Authority Act, was passed, then under President Muhammadu Buhari. And that act now said that social health insurance is mandatory for all citizens of Nigeria. And you must start from the state mandated social health insurance, which for Lagos State is very cool. And you know that the state law says health insurance, whether private or social, whereas the National Health Insurance Act says social health is mandatory. Now, which means there's a conflict. And when there are conflicting information like that, the national law takes precedence, which is why, that is not the case. So, in order for Lagos State to now domesticate the National Health Insurance Authority, as NHI Act in Lagos State, the governor, Mr. Babajide Olusola Sanwo-Olu, passed an executive order on the 16th of July 2024 to domesticate the executive order, which now says that social health insurance is mandatory for every resident of Lagos State. So that is the bottom line. So now, beyond the law, because we're not here to talk about law, I just wanted to give that as a background. Beyond the law that says that if you live in Lagos, you work in Lagos, you are supposed to have Ilera Eco, which is the state social health insurance. We all know that nobody budgets or plans for sickness or illness. Nobody does that, but it happens nonetheless. Okay, we all plan to have babies. We all plan to improve our careers, go to school, graduate, buy a car, buy a land, build a house, and things like that. We all plan and budget for those things. Nobody budgets or plans for illness. But the reality is that these things happen. And the other thing is that everybody is just one serious illness away from extreme poverty. That people will have to sell all their goods, their things that they have gathered together over years just to pay for medical bills. Now, this is one of the benefits of Ilera Eco. Apart from ensuring that you get quality health care, it is affordable, and then it confers on you financial protection against huge medical bills, which means that something you would have paid so much money for, either you pay nothing at all or you pay just something very little, which makes sure that you don't fall into financial ruin because of having to pay for big medical bills because healthcare is expensive in its right. So the insurance came as a solution to ensure that people can access medical services without needing to pay so much money or without having to have so much money. So health insurance is a financial solution to the difficulty of people being able to access healthcare for lack of money. So this is basically what it is. So Ilera Eco is standing in the gap for people who need and work in this work. That you can be able to go to a hospital, access quality healthcare, and be fine without having to spend so much. In some cases, you don't spend anything. So, um, Ilera Eco, like I mentioned, is state social health insurance. There are many plans under Ilera Eco, and these plans were created after extensive stakeholder engagement with different people. We have community leaders, market women, religious leaders, different stakeholder groups. We had conversations with them, even associations, before we came up with the plan. And what are the plans that we have? Because these plans are what will guarantee you access to medical services when you're under the hospital. So we have the standard plan. So the lowest plan we have is standard plan. That you know. Now, before I go ahead, all our plans have individual plan. That means you can buy it as a single person, and a family plan. That means you can buy it as a married person or someone with children. Family plan, we have a plan for family of 4 people, which is the father, the mother, and 2 children, or mother and 3 children, or father and 3 children, as the case may be. And then the family plan for 6 people, father, mother, and 4 children, or mother and 5 children, or father and 5 children, as the case may be. But the children must all be less than the age of 23 years. All of them must be less than 23 years. Okay, so that is the rule. Hello, I hope everybody can see me. Hello. So you can hear me because nobody is talking. Anyway, I'm just doing my test to sure that I'm not talking to myself and everybody can hear me. All right, let me just continue. Hopefully everybody can still hear me. So like I mentioned, so we have individual and family plans on that level. So we have varying plans, okay, and you can subscribe to whichever one meets your needs. So we have the standard plan, we have the standard JARA plan, we have the standard JARA Plus plan, then we have school plan, okay, that is for primary and secondary school. And we have the tertiary, plan, which is for higher institution or university students. Then we have the seniors plan for elderly people from the age of 60 and above. Then we have two diaspora plans, and one of them is the Home Connect plan, where people who are living abroad buy this plan for their relatives or their wards who live in Nigeria. And then we have the Waka Well plan, which is for people who come to Nigeria for holiday or are coming in Nigeria for business and short stay. So those are the plans that we have under the and all of them have family plans except the seniors plan, which is only available for a couple because of course at the age of 60 and above, you are not necessarily starting a family at that point. So you cannot buy it for your wife and yourself or both of you as a couple. The rest have individual and family plans. So the family of 4 families. Now, what are the services that are covered? Because that is where the story comes. Okay, what am I covered for under LLFO? So I will break down what people are covered for under LLFO into different sub-headings. The first one is primary care services. And we're talking about going to the hospital and doing treatment for common ailments. You have a headache, you have a sore throat, you have a cough, your nose is running, it's blocked, your skin is itching or scratching, you have a rash. Okay, all those things are covered under Elenco. Your tummy is paining you, you are feeling, things that everyday complaints that you tend to have, you are covered for this. You can see a general practitioner, which is a GP, and you can also see a specialist. Now, there are limits to the specialist that you can see. We don't cover every single thing under the sun, but what is covered is clearly spelled out, and if you read through the information, you'll be made aware of that right from the beginning when you're joining, and it needed to be shared to you for you to also, continue to read and understand what you're covered for. At the same time, you can also go to our website to check this information. So that is, consultation and primary illness. Then you can be admitted. There's a need for somebody to be admitted in the hospital. You can be admitted if you are vomiting, a person collapse, and things like that. That happens. Then we do surgery. We do surgery for children. We do surgery for adults. Appendectomy, enuraphy, someone has a hernia, they want to repair, it's covered, both for children and for adults. Children whose testicles are swollen, you do surgery to recover it. You have a lump in your breast as a woman, you have a lump anywhere that's called lipoma, those fat swelling, covered. So these are the things that we cover. Therefore, women, our plans are particularly biased against, not against, biased in favor of women. Where you have pregnant women are covered for antenatal, they are covered for vaginal delivery, they are covered for cesarean section, they are covered for postnatal care. That means the first 6 weeks after the giving birth. Then their newborn babies are covered for immunization. They are covered for nutritional and growth and work counseling. So even the newborn that is just giving birth, in case the child needs incubator care, that is covered. In case phototherapy is needed, that means when they put light on top of the baby, it's covered. So all those things are covered for women. We cover blood transfusion for everybody, both pregnant women and non-pregnant women, and even for men too, and children. Okay, we treat sickle cell anemia under LLI. Then we have cancer care. We have dialysis for kidney problems under LLI. We have annual wellness screening. That means that you can screen yourself, even if you're not sick, you're not going to hospital, but you want to screen yourself to ensure that okay, all my body functions, all of my body functions are optimal, or your organs are functioning properly. You can do annual screening. The only difference is that for cancer care, for the dialysis for kidney problems, and for the annual wellness, you can only do it in the second year of your plan. Which means if you join the right course today, you have to wait for that plan to expire, and then you renew it before you have access to those services. The other services you will have access to it immediately, at the beginning of the first year of your Leraco policy. Now there are conditions and terms and sorry, there are terms and conditions. For certain services, you will need to buy a family plan and pay in full, before you are able to utilize. For instance, you want to do surgery, the woman wants to give birth or do CS. If you want to do cancer care and all that, even in the second year, you have to be on a family plan and pay in full. Now, although we have instrumental payment for people who cannot buy the plan at once, I would say this for standard plan, it is 10,000. I have to check for the prices for the family, because family plans the prices vary. But standard JARA is the commonest plan that everybody tends to buy. 15,000 is the cost for individual. For family of 4, 65,000, that's 55, and family of 6 is 80,000. That's the cost. Why standard plan? Individual is 10,000. Okay, I think family of 4 is 35,000, and then family of 6 is 60,000. So I've given you the two plans. Now, standard plan, individual is 10,000, family of 4, 35, family of 6, 60. In standard JARA, individual is 15,000, family of 4, 55, family of 6 is 80. Now, for the higher plan, for instance, senior plan is 60,000 that you will, 60,000 for one person. Whereas if you buy it as a couple, it is 100,000. So means if your husband and wife buy it together, or you tend to buy it for your father and mother, who are older than 6, then you pay 100,000. So pay 120, you buy it individually. But for one person, it's 60,000. That's all. There's no family plan for senior plan, just a couple plan that you have. So now for the other plans, we can share that information, later. I don't remember the figures, but there are many. All these plans are many, and we have. So, but the ones that are commonest are the standard plan, the standard JARA plan, and the senior plan. And I've given you the prices for those ones. Now I told you that there are also caveats. Okay, some of these caveats are mentioned that you have to pay in full if you want to go to do surgery right from the get-go, and you have to be on a family plan. So if you plan that, if I join today, I will do surgery, then you have to buy family plan and pay in full. Like I mentioned, we also have flexible payment options, what we call pay small small, for people who cannot pay in full at once. For those ones who have to join our Ilera Eco cooperative, we have what's called the Ilera Eco cooperative where you register and then we're able to track your payment. Because in the past, what we had was people would pay in bits, utilize the scheme and then disappear once their medical condition has been resolved and they will not finish paying. That is abuse of the scheme, and we don't want that to happen because the scheme exists in such a way that it is a solidarity thing. The pool of money that everybody has put down is what we use to take care of people that are sick, since everybody will not be sick at the same time. That is the principle of insurance. Okay, so we expect that you join the cooperative, Lyrical Cooperative at NASMA, then you will register your name, give us your details, and then you start paying small small. It's just to ensure that we can track you and ensure you complete your payment, before you exit the scheme. Again, I must say it is mandatory by law, which also the national law has made it mandatory, and the executive order passed by government has made it mandatory. Now, LASMA is collaborating with ministry, department, and agencies to ensure that when you go to access their service, they will request for proof of Ilera Eco from you before you can use their services. You want to get building permit, you want to pay for PPA, you want to get your business permit, you want to renew it, they would ask you, even your association, that you, the Lascota or the RTN or the trade association, they will ask you for Ilera Eco. Now, because it's not a mandatory thing by law, and everybody is supposed to, pull together in that direction to ensure that, we all, contribute into this pool, and everybody, no matter who you are, can access healthcare services without having to spend so much money. Okay, so I've already talked about this plan. I've talked about what's it called, the cost. Now, so how can you join? If you want to join um, Ilera Eco, you will have to, buy an Ilera Eco plan. Luckily, almost all our hospitals, under Ilera Eco in Lagos State, we've trained them as enrollment centers. That means you can walk into one of our Ilera Eco hospitals. They have signages outside their building, so you can see. You see Ilera Eco provider here, Ilera Eco provider here. You can walk into one of our hospitals, and then say you want to join Ilera Eco. They will tell you what to do. You can come to LASHMA. You can go to any of the registered, NHI accredited HMOs in Lagos State, and they will sell health insurance to you. You can go on our website, www.lasma.com, and you can decide to say, okay, I want to read more about Ilera Eco or you want to register. You can go online and do that. So these are all the options available. We even have divisional offices around. So that information will have to get that across to you, where we have divisional offices in the 5 villages. We have in Ikeja, we have in Ikorodu, we have in Lagos Island, we have in Badagry, we have in Ike, we have divisional offices. So you can also go to any of our divisional offices and then you can register. You can also call our sales hotline, 080,000, 080,000, ask LASHMA. 080,000, ask LASHMA is our sales hotline. 080,000, ask LASHMA. If you call it, okay, then you speak to an agent and the agent will put you through on how. One thing we do is that there is no, we run a strict no cash policy. We don't pay money to anybody. When you want to register, they will tell you how to pay. Once you pay, you will bring the evidence or the receipt for transfer, what will show the person that will complete your registration for you. You don't give money to anybody. Nobody collects cash. If anybody should ask you for cash, that person wants to swindle you, and LASHMA does not have anything to do with it. I'm just putting out this because we posted all these notices on our WhatsApp and our social media handles for people to be aware that LASHMA runs a strict no cash policy. You don't pay cash to anybody. You pay online, you show your evidence of payment, and that's what is used to complete your treatment. Then we also have emergency services is also one of the services that you enjoy right now. Okay, that emergency service is going live in the next 1 or 2 months. We've launched it in December, where if you have an accident, you can call the LASHMA emergency line. When you call it, that one is 080,000 LASHMA aid, AID, that's LASHMA aid. You call it, and LASHMA can send an ambulance to carry you the nearest hospital where you'll be taken care of. Okay? And it happens to be in a hospital and it's an emergency, that hospital will attend to you without asking you for money, as long as you're under the right. And after that, if the hospital cannot take care of you any longer, it will let us know. And last time we'll send an ambulance to carry you to another hospital where your treatment can continue. LASTMA has also made it possible for people who cannot pay for them. We have the very poor people in our community. It's not everybody that can afford to even buy a plan of 10,000 or 15,000. Even though this 10,000 is for 1 year, it's not 1 month, it's 1 year. So what you pay, whether it's 15,000 you are buying the standard Jara or standard of 10,000, it's for 1 year. That's what we are going for. And it's a family, it's still 1 year. So it covers you for 365 days, 1 year. And then once it expires, you have to renew and continue your policy. So for people who cannot pay for themselves, those people, I'll find a way of sharing the amount. For people who cannot pay for themselves, so LASTMA has an arm called the ECOSHA arm, the Eco Social Health Alliance, ECOSHA, EKOSHA. They are the ones that take care of the vulnerable and indigent people in Lagos. They ensure that they get them under health insurance through one, the equity fund that the government has provided. But you know that when it comes to money from government money is not always safe. So government provides an amount, which is the 1% of the consolidated revenue fund of the state, is for the equity fund. That is used for vulnerable people, Indian people to come into the rental. That's what the money is used for. But because the money is not always available, there are many forces competing for government funding. The ECOSHA arm is also responsible for sourcing for funds from people, philanthropy, organizations, CSR, and even people adopting people. Like for instance, you can say in this Valentine now, I want to buy the plant for my neighbor that does not have money, does not have a job. Let him be able to cover himself and his family. At least that one you have helped them. Okay, you cannot feed them. You can buy the rest for the family for them. If they are just 4, you can buy 55,000 plan for them. And that is you helping them. At least for that 1 year, they will go to hospital and get it. They will not come and disturb you for money for hospital. Yeah, that is an example of what we're talking about. So that Indian people is taken care of by LASTMA. When those people go into hospital, the hospital is supposed to profile them because we have the means of identifying them. So and that is the profiling tool. They will be profiled. Once they are profiled, and then they will be profiled. Once they are profiled, then their names will be sent to LASTMA for us to now enroll them into Ilera-Eco through the equity fund. So, like I have said, this is how LASTMA operates. We have 24 hours customer service channel because you know that you can go to a hospital and they will do something that you don't like. They may ask you to pay for something that you're covered for. You can always escalate to us. Our lines are toll free. We have WhatsApp numbers that you can chat us to complain and report to hospital. That this hospital is asking me to pay for money, they're not attending to me, I've been here for more than 2 hours, they're not attending. You should complain so that we can make things better. Right? We also have the pharmacy that we have brought into our team. When the hospital says I don't have the drug, instead of them telling you to go and buy it, they can send that prescription to the nearest pharmacy to them, and you can go there and pick up that drug. So all these things are the things that we have under Ilera-Eco for you to enjoy. Like I mentioned, nobody plans to be sick, nobody plans to be ill, but illness is a reality of life. And we also need to plan for it, just like how we plan for Ashwebi and plan for weddings and housewarming and all those things. We need to plan for it as well. So it doesn't catch up when we don't have money. Because it might be when you don't have money that illness will come. And then what do you do at that point in time? So a lot of preventable deaths can be taken care of using the life. It is only when you are healthy that you can chase your business. It's only when you are healthy that you can chase money. If you are not healthy, the first thing you're thinking about is to get healthy first. So Ilera-Eco exists to ensure that every Lagos resident is healthy enough to be productive and useful to both themselves and their family. So this is just a snapshot overview of Ilera-Eco. So when you enroll, like I mentioned, you have to choose a plan. You come to Ilera-Eco or those places that I mentioned, the hospital, our divisional office, LASTMA online. They will ask you to first of all which plan do you want to buy. You choose that plan. You pay the money. Once you pay you now pick a hospital. We have a list of hospitals. We work with both public and private hospitals. Please, it's not just public. In fact, we have more 70% of our provider list are private hospitals, not public. So you can pick any hospital closest to your home. When you pick that hospital will be your first point of access to care. Anywhere, anytime you are sick, rather. That's the first point of access. But when that hospital cannot take care of you or cannot provide a service, the hospital can always refer you to a higher facility where that care can be provided. We also have dental and eye services under Ilera Eco. You can go and wash your teeth. You know, normally everybody's supposed to washing their teeth once a year. No matter how much you brush your teeth can never be clean 100%. So you need to go and be removing those scales and plaques that are piled up in your teeth, making our teeth yellow and funny looking. You know, Ilera Eco covers that. You can check your eyes. You can collect glasses. If you cannot see far, you cannot see near, your light is disturbing your eye. You can check the pressure on eye. You can check how far you can see. You can give you glasses. All these things are covered under it. Your back is paining. They say go and do physiotherapy for them to do massage of your back. Doctors that can massage back. Ilera Eco covers it. So these are all the benefits under Ilera Eco that you are covered. And this is how you join. After picking the plan, you pay. After paying, you pick your primary care provider. And the primary care provider is the person that will be taking care of you every day. If they need to refer you to eye, they refer you to eye. If it's dental, they refer you to dental. If they have it in the hospital, they can also provide the service as long as they have it in the hospital. If they don't have it, they can refer you. If it's an emergency, emergencies are covered. Okay, so these are the benefits of Ilera Eco. Like I said, when you are joining, everything will be explained to you clearly. Okay, for instance, for some things like surgery, there's a waiting period. If you buy Ilera Eco today and you want to do surgery, you have to wait for 4 months before you can do it. This is to ensure that the skin is not abused. People will have, a surgery they want to do, they will not do, they will wait till they'll come and buy Ilera Eco and want to do surgery immediately. We are going to use up all the money for everybody else, and that is not fair. So we put in this check and balance to ensure that people don't just come and use up their money and run away. So if you want to do surgery, you must wait for 4 months before you're allowed. If you want to give birth on the skin, whether it's vaginal delivery or you want to do CS, you have to have registered early for your antenatal class. In your first 3 months, you must register, okay? And then you must have been going for antenatal for at least 5 months before you can be allowed to deliver on the skin. Because we have found that a lot of people come into the skin when they are 6 months, 7 months, their belly is big like this. That's when they want to join the record. Many of them will now go to the hospital, also say it's CS because we didn't do antenatal, nobody monitor them, nothing. So we don't want that to happen to our women. We didn't CS for them. There's a risk surgery as well. Okay. So we want people to register early when they are pregnant so they can be monitored in pregnancy and the risk of having cesarean section will be less. That is what we are saying. So that's why we're putting all these checks and balances for people to be aware. Okay. And again, going forward, when you join Ilera Eco, there's a 30 days waiting period. You must pay on or before the 30th of the month for your plan to be active. So what I mean is this. 30 days waiting period is for us to ensure that your name is captured properly, your pictures are correct, it is not mixed up, your name is not given to somebody else, and your hospital is the hospital that you have picked. Okay, so but you must pay on or before the 30th of that month. If you pay on or, for instance, if you pay on or before the end of February, but February does not have 30 days, then it means that you will wait for March, and then from the 1st of April, you can now go and start using the hospital. Don't worry, it will still be 12 months from that 1st of April. So you will wait for that 30 days for us to ensure that, number one, all your details are correct, your pictures are correct, because we are going to put everything into our system. We don't use paper. When you go to the hospital, they will ask you for your policy ID number, and then the hospital will check your face and your picture and your name to ensure that you are the one that is coming for the start. So we need to make sure everything is done. Your hospital is correct. Some people will tell you your name will not go to Kogi when you live in the Kenya. Because all these are administrative errors. That 1 month allows us to ensure everything is clean and there's no issue. So you buy the record for the 30th, you have to wait for March, and then the 1st of April, you'll be able to use it. If you don't pay before the 30th, for instance, you go and pay on 31st, and just because that 30 days will not apply to February. For instance, in the March now, you not pay on 31st. Instead of it to start on the 1st of May, you'll be starting on the 1st of June. So if you don't pay on or before the 30th, you have to wait for 2 months instead of 1 month. So what we're saying is that there's a 1 month waiting period if you pay on or before the 30th. But if you pay after the 30th, you will have to wait for 2 months before you can use your Leraco plan. So thank you very much. I hope I've covered as many things. I've tried covering as many things as I can. I'm sure there will be questions, so maybe I can now use questions to answer, or cover some of the things I might have told over. Thank you very much for listening. Hello, can you hear me? All right, so I'm seeing some questions here. Like I said, I will try and share the amount for the plan. Okay, they will post it on the picture. Now, Ileriaco does not cover fiber operation. It does not cover fiber operation. Why I say that is that currently, it's not everybody that has fiber. Ileriaco plan is designed to take care of the most common complaints or most common illnesses that people in our community have. Now, the plan is that when more people join, Ileriaco, and the pool of funds available to take care of everybody is more, we can now add more conditions that we can cover, like fibroids. So you understand? And we will now add it. We need more people to join for us to be able to expand that coverage. So, okay, the link to enroll and register, yeah, I will try and get the link for you, and also they will post it here. So, a family of 5, someone was asking, 3 children, husband and wife. You have to buy a family, or you have to buy a family for family of 6, because a family of 5 is one, a family of 4. So you have to now buy a family plan of 6. So under standard JARA, that's 80,000 naira. That's 80,000 naira. So that's what I would say. So there are 5, you have to buy a family plan of 6. If you are more than 6, you just pay extra money to add the 7th, the 8th, the 9th, whichever number that you have. After you buy a family plan of 6, you now pay extra money to add the remaining people in your family to make up the number that is more than. Okay, so someone's asking plan that covers back pain therapy. You can buy your standard JARA plan. Okay, the standard JARA plan covers you for physiotherapy. You can see a physiotherapy. First of all, you can see a general doctor. You can see an orthopedic surgeon for your back, and you can see a physiotherapist. Because if you have back pain, the general doctor can refer you to see an orthopedic surgeon or direct you to the therapist. The therapist is the one that will now do the massage therapy that will now help you to relieve the back pain. So you can buy your standard JARA plan. Okay? Yes, our plan covers glasses. I mentioned that. So we have eye care. You can collect glasses. Standard JARA plan, seniors plan, standard JARA plus plan. The only difference is the limit. For instance, on a standard JARA plan, the limit for glasses is 10,000. Whereas on a standard JARA plus, the limit for glasses is 20,000. So it's double. So it means that if a standard JARA, if you want to collect glasses, last one will pay 10,000, you will pay the rest. But if you're on standard JARA plus, last one will pay 20,000 and you pay the rest. So that's the thing. All the services that are covered on the plan at the stage, the difference is the limit. Where one covers you up starting like 10,000, another covers you up to like 20,000. Where one covers you the therapy for 5 sessions, another covers the therapy for 10 sessions, another for 15 sessions, things like that. Those are the differences in the plan. But in terms of what is exactly covered, they are similar. Those are the limits for each plan is what differentiates. Well, I don't know about. Are you talking about the new tax law where if you have to have NHIS? Yes, you can use it if it is required. Yes, you can present your state mandated social health insurance plan because NHIS itself is also a federal social health insurance plan. Okay, so you can present your Leraco plan, if it is requested because you live in Lagos. And the NHIA Act, I told you, of 2022 says that everybody in Nigeria must subscribe social health insurance and you must start from your state mandated social health. That means from the social health insurance in the state where you reside. And for Lagos, it's the rest. So yes, I assume if they request for it and you have it, you can present it. Okay, so well, the choice of public or private depends on you. I've since discovered that when it comes to hospital, preferences, exist. Some people will tell you that they prefer private, some people will tell you that they prefer, public. The thing about public is that they have a lot of crowd. Okay, some private have a lot of crowd too, but they are few compared to the, public hospital. All right, so it depends on you. If you feel that public is the closest to your house and you want to choose it, it's okay. And if it is private that is closest, it's okay. But that is just the difference. It's just a crowd thing that is different. Yes. So for civil servants, there's a different plan for you. So just like I mentioned for what's it called? What did I mention now? For equity fund for the indigent. For public servants, it's different. So we generally have three categories of enrollees under LRF. We have the general public, general public, we have the public servants, and then we have the indigent people, those three. So for the public servants, you cannot, you have your own plan. It's called the formal sector plan. That formal sector plan has a lot of benefits because in addition to the benefits that you have, like under standard plan or standard data, you also have what we call additional benefits, extra benefits that is not seen under what's it called? The regular plans that the Leraco sell, okay? Or the last one sells, sorry. Those benefits are is to ensure that our Lagos public servants are healthy and productive to move the state forward. Okay. We had an MBA focal person training recently. I think that was last week, and we, told them about what they are covered for public servants specifically. Public servants have to be on the hierarchy. The head of service released a circular in December saying that all MBAs must ensure that their staff, whether it's hard or cool, whether it is full public servant on Oracle, they must be enrolled by that. We now release another circular in January that says that by the end of April, if you have not enrolled under LRICO, your salary will not. Okay, you can ask this from your different MBAs. They tell you, those are the two. One in December, one in January. One in December is that all MBAs must make sure that all their staff on there. The one in January is that by end of April, if you have not enrolled, that means that already civil servant salary are deducted directly. But you cannot use the RICO unless you come to our office and come and register yourself. Bring your name, your spouse, your children. They will ask you for, you have to give us that information so that we can give you your policy ID number. And then once you give your policy ID number, your name will be in that system. You can choose a hospital, and then after that, you can start going to the hospital to use the service. So that is the thing with the public servant. I have to get the address of the divisional office. There's one divisional office, but our main office, our main national office is in Ikeja here. It's the opposite Alausa main gate, the former building LRS of this before they moved to their new building. That's why it's on that. So it's just opposite Alausa main gate. That main gate you need to enter the secretariat. You look across the road on the other side, and you see our signboard, our signpost. That former building that LRS was using before. That was the last one. It's a good shepherd house. So I would suggest, he said, someone said that he subscribed 3 years ago, but they have not renewed for 3 years. Please go and renew now. Okay, renew now, and there'll be no penalty, and you'll not pay backlog. But going forward, people will start paying backlog. I'm not sure exactly when this new policy has been approved by the board of Lashma, and it's going to go in effect very soon. What we are saying is that when you are in Liraiko and your Liraiko subscription expires, you have 90 days grace. After 90 days, you must renew. If you don't renew, you will pay backlog. You will pay backlog and pay the new premium as well. So in order to avoid that, sir, please go and renew your Liraiko. It is beneficial to you. You're not just dashing off money. It gives you access to healthcare services that if you have to pay out of pocket for it, you know what it will cost. So please, sir, yes, go and renew. And I'm telling everybody here, too, you are only given 90 days grace after your labor request expires to ensure that you renew. If you don't renew, you will pay when you come after that 90 days, you will pay the backlog and still pay the full money for the new premium, and you will wait for 3 months before you are able to use the right because it's punishment. That is the punishment. So we're encouraging everybody to continue to use the right? And renew. When you use the you can compare about the services, you can improve on the services, and it will be better for everybody. So the former sector plan is still under Ilera, right? Ilera covers general public. The plans that I mentioned, standard plan, standard Jara plus, senior plan, diaspora home connect and Waka well, 2 plans, they're all for general public. The civil servant or public servant have their own plan, former sector plan. It's strictly for public servants. Okay? So that one is under Ilera. So, like I said, your money is being deducted direct. If your Oracle is deducted direct. For other MBAs that have contract staff, they pay on behalf of contract staff, on insurance. We're now saying that you need to come and put down your name if you are Oracle staff. Come and put down your name. If you have not put down your name, it means or give me your details. It means you don't have the right policy number, and it means you cannot use the services number in the right. So if your family has registered, okay, if they are already on the right, then they will have policy ID number they can use. If your name is not there, all they can do is just add you and say, we want to add the name of this person to this family. So, for instance, your husband is there and the children are not there. You can add your wife's name and your children's name. Just come to our office and do it. And then all of them will appear and we'll give all of them to their numbers and they can start using it. So, I've answered all the questions I've seen here. So, I don't know if there are other questions. But I've been saying that if anybody can hear me, nobody is talking.
Yes, thank you so much, Mr. Olubenga. I know I can see a question in the Q&A box, and the person is saying that I think I don't know if you've answered this, but it said, do you have physical branches in every local government? And also, the person is also saying that I think the last one they had, Chief Ganza sponsored it, but how do they know which plan they bought for them?
Oh, okay. So I don't get Eleganza. Is that what you said? Eleganza sponsored the
Yes, the
plan,
person
right?
is saying yes, sponsored
Okay,
their current plan, so they would like to know which of the plan
plan.
they are on.
Sponsor plan.
That is there a way
Plan,
they can know which of the plan they are on?
sponsor plan goes under ECOSHA. And that ECOSHA plan is equal to the standard JARA plan. So, I told you that on ECOSHA is trying to find a way to source for funds for other people to be able to, what's it called now? To be able to they enroll under any right. They do mobilization of funds, they go to philanthropy, they go to organizations to do CSR, and they have people sponsoring or adopting. So we have sponsor plans are under ECOSHA, and that plan is equivalent to the standard JARA plan. So what is in the standard JARA plan is what is inside that plan. All right. So that is it. But don't forget, sponsor plan is only paying for you. By the time that plan expires, because it's just for 1 year or 12 months, it has to be renewed. Okay. So what we're saying is that if you don't have, for instance, you don't have 15,000, you can always pay small. I talked about paying small, but you have to join the Ilera Eco Cooperative so we can track your payment and ensure you complete your payment, before that 12 months is over. That is just the only thing about it. So the standard plan now is 10,000 for individual, but you have to, like I said, the devil is in the detail. There are so many things that are not covered. So many things are not covered in the standard plan, because it's 10,000. Before now, we only had standard JARA plan. But people kept saying that you have a cheaper plan, you have a cheaper plan. So we have to, create a standard plan. This is 10,000 for one person, 35,000 for a family of 4, and 60,000 for a family of. But many things are not covered. For instance, surgery is not covered under standard plan. Delivery is not covered under the standard plan. You understand? It's not covered. I think all that is covered. Delivery is not covered. surgery is not covered. Admissions, yeah, you can be admitted. Glasses and all those things are not covered. You can only go for regular outpatients, away from me, I'm coughing, I'm just paining me, and they can admit you, if you're vomiting, they can give you drugs. But other things like surgery, that I mentioned, physiotherapy, delivery, and all that, they are not covered. Those things are not covered on standard plan. Coverage for those things start on standard JARA plan and above. So I just want to tell you that. So I can explain. So for a small company of less than 10, you can, you can contact Lashma, as I mentioned, 080,000, ask Lashma is the number. That's our sales. You can call them. So we have a plan for you. It's not a problem. We have a plan for you. All right. And they will even give you an account officer that will be helping you to register. Even when you register, how you can complain, the have with your, contact at the hospital and things like that. So standard JARA plan is where surgery and delivery is covered for. Standard plan does not have that. So standard plan just a plan that, okay, you still have access to healthcare service. For instance, you are vomiting, you are having malaria, you are having typhoid, you are skin infection. I mentioned all those things that I talked about before. They want admit you can use that standard plan. But when you now come to you want to go glasses, you want to do your treat, you want to do surgery, you want to do that. Standard JARA is where it starts. You have standard JARA plus. Okay? And seniors plan. Seniors plan is for elderly people, right? But there's no delivery there because you don't expect people from 50 to be using them. They're already menopausal. You understand? So then the diaspora plan that I mentioned, where people outside the country can buy for the people here, that one to cover that. Okay? That one to cover that. So those are the plans, okay, that have those ones. So, like I said, the sponsor plan is equivalent to standard JARA plan. So, and it is individual. It is individual. So, if you now want to, do it on your own, you can go to the family. You can move to the family of four if, you and your family are not more than four in number. If you're more than four, you have to be a family of six. But like I said, there's a chance to pay more. You don't have to join the NERA into our cooperative. So, you join the NERA into our cooperative, then they will tell you how to go about paying small, and you can pay small, you finish paying, and you can still enjoy healthcare service. Yeah, we will send the prices and the plans they are doing, including the family prices, the family plans, and even what is covered. I'll share with you. Yes, even without LASTRA, you can. You can. Without LASTRA, you just come to, like I mentioned, you can come to our office, you can call the sales offline, 080,000 at plasma, and you can go to any of our divisional offices. Don't worry, we'll share those information with you. And then you can come without LASTRA, we will register you. Although we are trying going forward to see how we can collaborate with LASTRA, and we're asking for LASTRA or NIN or both. But that has not started yet, but it's something that we're going to do very soon. So at least you must have your NIN, okay? Because even LASTRA is trying to work with NIN such that when you have NIN, it will automatically generate LASTRA number, something like that. So that conversation is ongoing and there is no finalize. So I would suggest to have the LASTRA, but right now if you don't have it, you can still come and you register it. Yes, the sponsor plan is equivalent to standard general plan. There's surgery under it, there's video under it, there's eye and dental under it. But like I said, the sponsor plan is paid for, it's expired. The person that paid for you this year, we want to pay for somebody else next year. Okay? And we're not able to tell you paying for anybody again. So you have to be on your own. This is why I said that if you have a family, you now have to buy a family plan, and that's around there. And you pay much more, you don't have money to pay at home. Okay? So we have hospitals in the various local government. All our hospital list is on our website, www.lacma.com. Okay? And the hospital list is divided into LCD and LG. So you can look at the LCD and LG that is your own area and look for the hospital that's closest to you. If you call the sales hotline to, like I said, 080,000 ask Lashma, they can tell you which hospital is closest to you. You tell them where you are. Or you can also come to our office opposite Alausa Media, like I mentioned. You go to a part house, former LIRS, or you go to any of our divisional offices, and we will share we'll give admin the address of the divisional offices so you can find that out. Okay, so our office is in Korodu. I do not recall where it is, but it is not in Aju. I think it's where the area where the original street is. I don't think it's far from there. I'm not saying it's the opposite where the original street, but I don't think it's far from there. Again, when I give the admin the address, when we give the admin, we'll be able to, we'll be able to see, all right, when we give the admin. But right now, you can just call 080,000 ask plasma. Okay. If you know how to use that letter, ask plasma, ASK, LS, LASHNA, you can use your keyboard to determine which letter is attached to what number. And then that's how you get out the number. We don't have office in Adimosho. What we have is in Ikeja. We have an office in Ikeja. Okay, I don't think it's Ayoboa. No, we don't have office in Ayoboa. So we only have one divisional office in each village zone, which I mentioned. One divisional office. We also have kiosks, small kiosks. Those ones are in many places. So we will share that too. Those small kiosks, many of them are in different, some are in hospitals, some are on the roadside, different places. You get that you can go and register. Then we also have what we call this virtual booth. You see a virtual booth like that. That virtual booth, we have one in Ayetoro Market in Effect. We have one in Adamo Market in Korodu. We have one in Sabo Market in Korodu. We have one in Ketu Market in Ketu. And then we have one in Sabo Yaba. It's like a big booth. You see it's white, like a white cabin like this. It's a white cabin. You can go in there and also ask how to enroll into the But if you're a public servant, please come to our office. Don't go there. For public servant or civil servant, come to LASTMA office. That's what I'm telling you. LASTMA office for public servant. That's the only place you can come. For other people, you can go. I just give you those virtual booths. I'm sure some of them have seen them before. Those ones that have white, like white cabins like this. I mentioned that in Ayetoro Market, Ketu Market in Ketu, Sabo Market in Yaba, Adamo Market in Korodu, and Sabo Market in Korodu. Those are the five that we have for now. So if you go to any of them, we can tell you how to also enroll into the 080,000, not 082. Ask LASTMA, ASK, then LASTMA. So the person that wrote 086, that was wrong number. 80,000. So 080 then ask LASTMA. That is ASK LASHNA. Yeah, you can register at our kiosk too. You can register at our kiosk. So when we share with the admin, you can register at our kiosk. You can, tell them what's it called now. They will tell you how to enroll. They will check your information. They will tell you which plans you can pay for, what the prices are, and how to enroll. Yes, the 080,000
Thank you so much.
It is so free. So yes.
Okay, thank you so much, Mr. Olubenga, for taking our time to take us through today's session. I'm very sure a lot of us have learned a thing or two. So please, I'd like to ask, on behalf of the participants, if we can get maybe a brochure, a slide that contains all of this information as regards the different locations and other information that they'll be needing, so that we as a fund can share with them via their emails, so that they can have this information firsthand.
You'll get slides for them.
Okay, thank you so much, Mr. Omega. And thank you so much, everyone, also. Thank you, Mr. Omega, for taking our time of your busy schedule. I know you had other engagements to attend to too. Thank you so much, sir. We really appreciate you. And thank you so much, everyone, for coming onto the session. Sorry, sir, we didn't get that.
Send the slide to you today or tomorrow later.
Okay, all right. So we'll be expecting so that we can share it with them. So for our participants, you'll be getting the slides on and by your email. For those that are joining us on all our other social media platforms also, if you can please drop your email address in the chat box, we'll pick it up from there so that you don't miss out, so that we're not just attending to just those participants on our Zoom platforms. Please, if you're joining us via our YouTube channel, you're joining us to Facebook, you're joining us via our LinkedIn channel, please do drop your email addresses in the chat box, and we'll pick it up from there so that we can share with you the slides for the session so you don't miss out on any of the information. Thank you so much once again, Mr. Lubega. Thank you so much, everyone. So the moment the session is done, there's a survey that'll be dropped in your chat box or in your mailbox, and the order would pop up on your screen. Please, we need to get your feedback from the session, and it will be a pleasure to hear from you, and you definitely be getting the slides from the session in your mailbox. Thank you so much, everyone, for attending today's session, and do enjoy the rest of your day.